Thank you, Meredith. Good evening, everyone. I would like to take this opportunity to thank Bobby for inviting me to speak on Heartland Cares and to also thank the McCracken County Library for providing these virtual presentations. I've had the opportunity to listen to some of the recorded sessions and find them very interesting, and you'll see that they're on a wide variety of topics. So you should like their Facebook page and listen in on some of these. And again, I want to thank Meredith for being our technical assistant tonight. My name is Donna Reeder, and I am the Executive Director for Heartland Cares. I have been with the agency for about 8.5 years in various roles and love the opportunity we are given to serve our clients. I would not want to leave out my wonderful staff, so I included a picture of them. Without this team, we would not be able to do what we do, and they all have a heart for our clients. Next slide. Heartland Cares is a 501c3 nonprofit organization. We provide comprehensive, client-centered quality health care to HIV-positive individuals. We offer support services, prevention education, free HIV and hepatitis C testing. Our mission is to embrace those affected by HIV and AIDS with open arms through care, prevention, and community awareness. Within the community, we strive to prevent new infections and reduce the stigma associated with this disease by promoting awareness, acceptance, and equality. Next. Heartland Cares began in 1996 as a housing assistance program to HIV-positive individuals. It was 2 years later we became the first agency in Kentucky to open a Ryan White medical care clinic for persons living with HIV. In 1999, we began prevention services, reaching out into the community, providing testing and counseling. In 2002, we were able to begin support services through the Ryan White program. And in 2012, we partnered with Nashville Pharmacy Services and have now an on-site pharmacy for our clients. In 2016, through the Ryan White Part B program, we opened up a food pantry. In 2019, we began hepatitis C testing and treatment. And we're excited about this year. We will be opening a new prevention and outreach center very soon, which will enlarge our food pantry, expand our communication, education, and testing. So we're excited about that. Next slide. So medical treatment is provided by two infectious disease physicians, Dr. Anita Fleener Ford and Dr. Carl LeBoon, who are on call 24/7 for our clients. Our interdisciplinary team consists of medical staff, a physician assistant, nurses, medical assistant, office staff, and we have a case management team and housing team for support services. We have a prevention team and administrative staff, and Heartland Cares is overseen by a board of directors. Next slide. Every program at Heartland Cares is directed toward helping patients stabilize their health, achieve better health, and maintain good health through access to regular medical care and medications. Services at Heartland Cares are provided to all persons regardless of race, ethnicity, gender, age, religious beliefs, sexual orientation, or even the ability to pay. Primary and specialty HIV medical care is provided to include mental health services, nutritional services, adherence assistance, immunizations, and lab tests. Next. Our support services consist of medical case management team who assist patients with medical referrals, health insurance continuation, providing transportation services, food, and financial assistance. Heartland Cares also operates long and short-term housing programs designed to help patients maintain stable housing through rental and utility assistance. Next. Our prevention and outreach program consists of a team who reaches out into the community at large to provide free HIV and hepatitis C testing. Education on HIV, how it's transmitted, and how to prevent the spread of the disease is taught to the public. We provide risk assessments and resource tools to counsel individuals on their high risk potential and how to reduce those risks. Our clients are also offered addictions and focused support groups as well. Next. At this time, I'd like to give you a little quiz to test you on your knowledge of HIV, and it's just true or false questions, and we'll come back later and go over the answers. Number one, HIV can be passed from one person to another by hugging or kissing. Would that be true or false? HIV can be passed from one person to another by coughing or sneezing. True or false? If a woman with HIV becomes pregnant, she can pass it on to her baby. True or false? 2, if someone gets HIV, they will not live a long time. And the last question, you can tell if someone has HIV just by looking at them. Okay, again, we'll go over the answers in just a little bit. Next. Now I'd like for you to see a video. Eric, he's a long-term HIV survivor and a client of Heartland Cares.
My name's Eric and I'm a client at HCI, Heartland Cares. I've been HIV positive for 30 years. I just celebrated my 30th anniversary in September of this year. It was on September 2nd of 1987. For me, I was fortunate in that I found out very shortly after becoming infected. I had a very, very bad flu, and I lived in Chicago at the time. I went to a doctor that treated gay men, and he said, it's either the flu or, he said, you're seroconverting for HIV, so wait about 6 weeks and get a test. And I did, and the results were positive. So the good news for me is that it didn't go on until I was really sick. I sought out a doctor who, again, I was fortunate. This particular doctor was so overwhelmed with seeing people die that he had adopted a treatment style that was counter to all the best advice at the time, and he did nothing. He just did tests, followed my T-cell count, and really did nothing in the way of prescribing. That was considered at the time a not good thing for a doctor to do, but in retrospect, it was the best thing that could have happened. I wasn't exposed to the first medications that were very toxic, and I didn't start medications until the ART, or highly active antiretroviral therapy, became available, the cocktail, in about 95. But from 87 to 95 and beyond, it took about till 98 when they were able to tell me, oh, guess what, you're going to live. So I spent a little over a decade expecting to die. So my mother gave a good face that she took it well. I came to find out that she didn't take it as well as I thought she did. but that was after her death. My father, well, my parents are both from Europe, so they're a bit more progressive. My father's from Switzerland and my mother was from Germany. And my father was very practical and not necessarily the most warm and fuzzy person in the world, but I do remember when I told him the first words out of his mouth were, "I love you." So I was very fortunate in that respect. I realized there's many people that don't get that reaction from parents. Also, I was living in Chicago, which is a bit more progressive city. And I was attending dental school at the time. And I'd come out to my friends just prior to this information of HIV. And I really got no discrimination at all from them. They were concerned for me, but I didn't. As my decision was, if people are truly my friends, they will remain my friends regardless of the information. And I was very fortunate to have that be the case. Everyone remained my friend. Now, on the other hand, and this is in later life, when people should know better, when you go on dating applications or things like that and you tell people what's going on, I've gotten some very negative feedback. And I usually direct them to Google something, or I'll get a little bit more aggressive and say, get a clue. And I try not to let it bother me, but it does when people are uninformed. And in today's age, when we have reached the point where undetectable equals untransmissible, which is the latest news from the CDC, it's more important than ever because people need to get tested and not be afraid of the potential diagnosis, because with treatment, we can live a normal life and not run the risk of infecting other people. I was moving from Chicago to Kentucky here to help out my father, who's elderly. And I had an agency the agency in Illinois is a little different. You just Google the state of Illinois and it's called something different. And it took me a little bit of searching to find, because Kentucky is structured differently with agencies throughout the state serving certain portions of the state. But I did locate HCI, and as a matter of fact, I just spoke 10 minutes ago to the first person who I talked to on the phone, and they were just delightful and made me feel really good about things, because I was concerned about how I was going to continue treatment and handle co-pays, because at the time I was leaving a job to help out my father, and I was going to be on COBRA, and I needed assistance with my COBRA payments. Things with my father didn't turn out all that well, and that is what it is. But I ended up needing to leave what turned out to be a toxic environment, and I needed to leave quickly, and I didn't have many resources. And Heartland Cares was extremely expedient in helping me find housing and has paid rent for me while I've been getting back on my feet. They've provided mental health counseling, which has helped me a lot because I suffer from depression and anxiety, which runs in my family, but also is a hallmark symptom of people that are long-term survivors of HIV. Just because I'm here 30 years later doesn't mean that everything is rosy and I'm all better. There are challenges mentally and physically to being a long-term survivor, especially when you have to make the shift from being sure that you were going to die by the age of 35 and finding out you're not, and changing how you think about saving and retirement. And so I just turned 54 years old, so I've beat those odds pretty well. So Heartland Cares has helped out with me getting it signed up for other forms of assistance when I needed it. Fortunately, I no longer need food stamps, but there was a period of time I needed them. And they were just great in helping me navigate the intricacies of the system. I see Dr. Fleener, and she's very receptive. Again, I came in with essentially no problems, so I was in maintenance stage. Because I've been HIV positive so long, I have developed resistance to a number of medications. So I'm not one of those people that are eligible or able to take a 1 pill a day solution. I take 4 medications, and those are taken twice a day. Well, actually, not all of them. I take 2 medications in the morning and 4 at night. But I've been used to taking medication twice a day for so long, it's not a big deal. We looked into other options for me, but right now, these are some of the newest medications, and they're just not formulated into single pill solutions, which are not a big deal for me. She has helped me with making sure that my depression is under control, and has been a really good asset. I was hospitalized with something completely unrelated. I had a pulmonary embolism, but she was the attending physician that came into the hospital, and her bedside manner is phenomenal. I already knew this, but she reminded me just how lucky I am. It was a small pulmonary embolism. I was only hospitalized for 2 days, and that could have been much worse. That could have actually been fatal. So, and she was wonderful. And apparently they were able to reach her at 2 in the morning to tell her I was in the hospital, and got information from her, and saw me both days I was in the hospital, and was great.
Next slide. Currently, Heartland Cares serves 43 counties. 26 of those are in Western Kentucky and 17 in Southern Illinois. We serve over 400 clients in these 43 counties. The map depicted in this slide shows the number of clients by county, with McCracken County having the largest number of our clients at 126. Christian County comes in second with 72 of our clients, and third is Graves County at 32 clients. Next. This next slide is a demographic of our clients by gender. The red represents our male population, which is our highest population at 70%. And the blue represents our female population at 29%. Next. This demographic shows a breakdown of our clients by race or ethnicity. In the red is our largest population of white individuals at 65%. The blue represents our Black or African American population at 31%. The pink is our Hispanic or Latino at 3%. Next. This slide is a patient data report from fiscal year 2019 and 20, which compares Heartland Cares with the state of Kentucky. So in that year, we had 411 clients, and the state of Kentucky showed 10,794 HIV positive individuals, with the largest race being white, both at Heartland Cares and in Kentucky overall. And there's also a breakdown of individuals with HIV and those with AIDS, which was about half for Heartland Cares, 50% each. Next. So what is HIV and AIDS? HIV stands for Human Immunodeficiency Virus. The virus attacks cells in the immune system, which is the body's natural defense against illness. HIV destroys a type of white blood cell called a T helper cell, which is also referred to as a CD4 cell. and it uses these cells to make copies of itself. HIV targets the CD4 cells and grabs onto the surface of a cell. It gets inside of it and then becomes part of the cell. When the infected CD4 cell dies, it releases more copies of HIV into the bloodstream, and the cycle continues. AIDS stands for Acquired Immune Deficiency Syndrome and is also called advanced HIV infection or late-stage HIV. AIDS is a set of symptoms and illnesses that develop when an advanced HIV infection has destroyed the immune system. Without medication, people with AIDS survive about 3 years. Next. So why treat HIV? Recent research shows that HIV-infected patients who received ongoing, regularly scheduled care had significantly lower viral loads and higher CD4 cell counts. The viral load, which gives an idea of how much of the disease will progress. A lower viral load means the virus probably isn't actively reproducing as fast as did. This does not mean a person is cured, but is compatible with a normal or near normal lifespan. When the HIV viral load is undetectable, there is little to no risk of infecting others. Next. So let's go over the answers to our quiz we took earlier. 1, HIV can be passed from one person to another by hugging or kissing. If you said false, you are correct. HIV can be passed from one person to another by coughing or sneezing. That answer is also false. If a woman with HIV becomes pregnant, she can pass it on to her baby. This answer would be true. HIV is transmitted through blood, semen, vaginal secretions, and mother's milk between two people if one of them has HIV. However, mother-to-child transmission cases are low due to antenatal screening, treatment to block transmission, avoiding breastfeeding, and elective cesarean delivery. Using all these methods, the chances of a woman with HIV having a healthy baby have increased dramatically and are now around 99%. You cannot contract HIV by sharing utensils, touching an HIV-positive individual, or through everyday interaction. Question 2, if someone gets HIV, they will not live a long time. This answer is false. Many people who have HIV live happy and healthy lives for many years, particularly if they find out they are positive soon after contracting HIV and taking their medications regularly. And the last question, you can tell if someone has HIV by just looking at them. Well, that answer is also false. Many people have HIV without even knowing it themselves. The only sure way to find out is to have an HIV test. Many people on HIV treatment are in great health. Next. Many social, environmental, and economic factors come together to cause barriers and challenges that complicate HIV treatment and prevention, especially in rural areas. Some encompassing factors include poverty, limited resources, and structural barriers that pose challenges to accessing services. 94% of Heartland Cares clients are at or below the federal poverty level. Many of our clients seem to have transportation issues, need help financially with bills, health insurance and co-pays, and food. Next. Now I'd like for you to hear from one of our providers, Dr. Carl Laboon.
My name is Dr. Carl Laboon. I'm one of 2 infectious disease physicians that works at Heartland Cares. I've enjoyed working here since April, well actually since around June of 2000 when I moved to the Paducah area. I've had the privilege to take care of hundreds of patients from Western Kentucky and from Southern Illinois area who have had HIV infection. And one of the very satisfying things about HIV care is that we have treatments now that are highly effective at preserving not only quality of life but length of life. And it's unknown by a lot of people, but that treatment of HIV now is as simple as 1 pill once a day for the majority of the patients that we take care of. And that 1 pill once a day basically gives people a very near normal life expectancy, if not normal. And it's well tolerated. There are very few side effects of the medicines we have to offer now. Our biggest challenge is making sure that we've identified people who have HIV infection, that we have created comfort for them in an environment where they can receive ongoing care. Despite efforts from the community, despite efforts on a national level, there still remains stigma associated with HIV infection. Unfortunately, there's not a day or even a week that goes by that I don't see somebody's health care with HIV negatively impacted to some degree because of stigma. And if we could just get rid of some of those problems associated with HIV infection, we could provide care and services to a much larger group of people. It's hard to put into words just how effective this treatment is. I've seen many patients who have advanced HIV infection or AIDS, who have lost tremendous amounts of weight, who are battling cancer or who are battling any variety of infections, who was simply getting on HIV treatment within a matter of weeks to a couple of months or 6 months are back to fully functional, able to go back to work, able to really enjoy a very high quality of life. And unfortunately, because of the stigma associated with HIV, we can't really put up a poster, we can't put up a video sequence of what we see in terms of patients' response to therapy. Otherwise, I think people would be absolutely amazed at what these medicines and what healthcare for HIV can provide. When I was first in training, which would have been the mid-90s, a lot of the care we provided for HIV was in the hospital. The treatments we had to offer were managing or trying to prevent some of the complications of HIV, but it really wasn't treating the HIV infection itself. Starting in the mid to late 90s, they developed newer medicines and a deeper understanding of the pathophysiology of HIV. And basically what was learned is that if the virus is attacked at a couple of different positions in its life cycle, the medicine is much more effective. And so the mortality from HIV drastically diminished in the mid to late 90s and has really only steadily improved since that time as medicines have become easier to take, as they've become easier to tolerate, and as the treatment regimens have become more simple. But the main concept is we're attacking the virus at a number of different points in its life cycle. Pharmaceutical companies have worked together to combine their separate products into single pills. So much of what we have to offer now might be 3 or 4 medicines combined into one single pill, which allows us to aggressively treat HIV with a regimen that might be 1 pill once a day. Treatment of HIV requires really one major factor, And that's a commitment to taking that medicine every day. And a lot of people, when they face problems with housing or finances or insurance or transportation, there are a lot of ways that taking one pill once a day can become more difficult. Heartland Cares is an organization that is trying to house numerous different services under one roof. And through that program, we're able to impact people by meeting their needs in a number of different ways, which allows adherence to medication, which allows them to continue one pill once a day without a missed dose. And that opportunity to house different services under one roof is vital to helping make sure that we're providing the best HIV care possible.
Next slide, please. So why do we do what we do? The services we provide are not only to improve health outcomes of HIV-positive individuals, but to also reduce the transmission of the disease. HIV infections in the United States continue to be a major public health crisis. An estimated 1.2 million Americans are living with HIV, and 1 out of 7 people with HIV do not even know they have it. It is estimated that 91% of new HIV infections in the U.S. are transmitted from people not diagnosed or diagnosed but not in care. Next. Unfortunately, in today's society, there's still a stigma that surrounds HIV. HIV-positive individuals are ostracized from family and friends. They are discriminated against in the workforce, and many have no support. It takes a community to reduce the stigma that surrounds this disease. Stigma can lead to a lack of support or empathy for individuals. Stigma can result in symptoms of being ignored, lead to poor recovery, and lower a quality of life due to isolation. Ways that one can help bring the cycle of stigma are to get the facts, get inspired, learn more, and get involved. In this slide, there's 2 links to the CDC's website that can provide you more information on HIV and how to help stop the stigma that surrounds the disease. Take the time to listen to personal stories of people living with HIV and get involved. Reach out to your local HIV/AIDS organizations such as Heartland Cares to see how you can help. Get involved in HIV awareness days. Next. World AIDS Day is an example of an annual National HIV Day. It is a time for people worldwide to unite in the fight against HIV, to show support for people living with HIV, and to commemorate those who have died from AIDS-related illness. World AIDS Day has become one of the most widely recognized international health days and is a key opportunity to raise awareness and celebrate victories such as increased access to treatment and prevention services. World AIDS Day is annually every December 1st. Next. Our work may be challenging, but it can be very rewarding. Heartland Cares wants to be that safe place where HIV-positive individuals can come and not be judged or shunned for their illness. Carrying out this work is dependent upon grant funds, donations, and support from within the community. You can help, again, by volunteering, educating yourself on HIV, and by giving monetarily. For more information, you may call our phone line at 270-444-8183. Like our Facebook page at Heartland Cares Incorporated, and share our posts and stories with your friends and family. You may also visit our website at www.hcares.org. Next. I am truly proud of our team and what we've been able to accomplish throughout the years. They work diligently to make a difference in the lives of our clients and in the community. Last fiscal year, we tested 840 individuals, and those testing positive for HIV were immediately linked to care. At the end of last quarter, 94% of our clients had a viral load of less than 200 copies per milliliter of blood, meaning their infection is undetected and cannot be transmitted to others. Our housing department assisted with rental and utility payments in the amount of over $200,000. Our support services team distributed 246 food boxes or food vouchers to our clients and their families, and paid almost $200,000 in client health insurance or copay expenses. Since we started HIV treatment, Heartland Cares has treated 47 HIV positive pregnant women, all of whom delivered HIV negative babies. In a letter written by Elton John and published by Britain's independent newspaper, Elton John wrote, "Everyone should understand the risk of HIV, and everyone who needs it should have the chance of dignified help and support." That concludes my presentation tonight, and I want to thank you for joining us. And I can take questions now if you have some. I'll do my best to answer. I'm not a medical person, but if I don't know the answer, I'll get it for you. If you would like to reach me, my email address is dreeder@hcares.org. I can type that in for you under the chat box here. Again, I want to thank you for your time, and for Bobby for inviting me to speak to everyone. Looks like we do have a question. Do you see a difference in the needs of your older versus younger clients? That's an excellent question. We are starting now to see more aging clients as the medication and treatment has improved so much over the years. We do have a larger, older client population. And with that comes illnesses from just aging and things like that. They're always willing, they want the help. They're easy, to reach and want the help. The younger clients, it can be more difficult to get them into care and to stay into care. And because they are usually healthier, it's easier to treat them. Any other questions? Well, if there are no further questions, I guess that will end our presentation tonight. I hope everyone has a wonderful Christmas and holiday season, and that you're safe and healthy. Thank you.
Thank you very much for presenting with us, Donna. It was really insightful.
Thank you.
Alrighty, if there are no questions, then we will close this out for tonight. Thank you again for presenting with us, and thank you all for attending.